So what I'm going to talk today about is breath analysis and how it can be used and how it can be used in the home by everyone. The first thing is about what are breath volatiles. Why have you got so many chemicals on your breath? They represent pretty much everything you're exposed to in your lives. They're the food you eat, the things you drink, the chemicals in the environment, but they're also representative of what your body's doing. They're endogenous compounds that are generated as you process sugars, as your muscles operate. These mixtures of chemicals represent that everything's happening in your body and the exposure and the risks that you're involved with. One thing Owlstone has been doing is building up an atlas of all these chemicals. With the support of one of our investors, the Gates Foundation, we sort of built an interactive sample biobank that links all those different chemicals in breath to the patient data that's there, where we can apply models to understand what's happening. So there's all these compounds on breath, but what can you do with them? And I'm going to do quickly 3 examples of tests under development at the moment. Some already available. This one's the device is FDA approved. Others in late-stage clinical trials. So this first one is talking about hydrogen and methane on breath. Now, this comes from your microbiome. When you eat any carbohydrates, they need to be broken down by the bacteria in your gut. Now, if some of those bacteria aren't in the right place, or there are too many of certain types of bacteria, that fermentation produces gases, hydrogen and methane. They drive some of the discomfort, bloating, and all the side effects of IBS. So being able to measure those all the time gives you great capabilities in diagnosing problems. And this device is a pure point-of-care device, something you can take home with you, links to your phone. The app that it's connected to tracks symptoms, your food, and the hydrogen and methane, and provides the information to a doctor to be able to make clinical decisions. And quick example of that, this is a case report of something you could never do with with standard testing at the moment, because you wouldn't have the number of data points. So each one of these blue dots is a measurement of methane, one of the 2 gases this device is measuring. So every day they were taking multiple measurements of their methane as they ate different foods. And these methane levels for this patient was particularly high. It was causing all sorts of GI symptoms. The doctor was consulted. They identified methogenic overgrowth, so too much of a certain type of bacteria, and they were given an antibiotics regime. That was the standard of care. But as you can see, after that first antibiotic dose, it knocked it down a bit, but it didn't solve the problem. And normally in the standard of care, they would have gone on to something else. But the doctor could quickly look and see it did do something. It was just, it wasn't a harsh enough treatment. So a second treatment knocked it down. And this is where this sort of continuous information, the amount of data you can get from a breath sample, which is available all the time, I mean, you can always breathe, or you've got other problems. So lets a patient take many, many samples and really delve deeply into the data that can be generated. But that's not the only application we've been exploring. Another big problem in the world is liver disease, especially advanced liver disease, and the kicking into cirrhosis and decompensated cirrhosis. And the problem is definitely real because it's most often diagnosed in emergency rooms. So 50% up to 75% of people find out their liver's decompensated and it's too late to do anything about it in an emergency room. So there's definitely something we're not doing right today. And here we were looking and thinking, how can we use a breath test to help this? And actually, you test your liver every day when you eat food, drink, particularly alcohol. Your liver's there to take the chemicals out of your bloodstream, metabolize them away so they're safe. So every time you eat, you are challenging your liver. If your liver's not working very well and you drink a glass of orange juice, instead of those compounds in there being sucked out of the bloodstream and processed away, they go straight into your circulatory system and are there being continuously breathed out. So you can make a test with orange juice and a breath test. We went slightly more controlled than how much pulp is in orange juice to how much compound you receive, and build a small test where you receive a compound, a cocktail of compounds, those 3 compounds that you drink. A few minutes later, you take a breath test. What this is doing is looking at how those compounds were extracted from the liver and how they were metabolized. So a simple core functional test of the liver. Now, you might think there are really simple liver function tests out there already. There are things that are called liver function blood tests, but in effect, those really look at how much damage, they're damage markers in the liver. They're not telling you how much function the liver has. And there's imaging techniques, as you'll see, ultrasound and things to measure the fibrotic state of the liver. But again, they're looking at the damage, not how well your liver is working. So having these sort of tools that let you really screen at what the liver's functionally doing lets you, test orthogonally what's happening to the liver, but also these tests are, like, you can post them out to someone. They bring screening to everyone. You can try and reach those patients that otherwise wouldn't be found till they hit the emergency room. And if you get them early, you don't have, the treatment can be lifestyle, and there are a couple of drugs now. It's much simpler treatment. If they're caught late, treatment is very difficult. So the final one is lung cancer, the biggest cancer killer in the US. And this is what Owlstone was founded on, Owlstone Medical was founded on. It was trying to find a way to get lung cancer tests to the individual in the home. There are tests out there at the moment. They have limitations. They either can't detect cancers at the earliest stage when treatment is most effective, or they require hospital visits, people are resistant to it, and their compliance is really poor. Like low-dose CT is no copay, sort of free in the US, only 4% people comply with it, and state to state, that's, in some states, it's incredibly low. So people just don't want to do the test. So if we can bring a test to a patient, we can hopefully increase that compliance rate as long as we can get the good enough sensitivity at early stage. And I talked about using a probe, taking something and testing your liver. We've taken exactly the same approach with lung cancer. So here we've looked at an inhaled probe, an inhaled compound that you breathe in, and then this reacts with certain enzymes in the tumor microenvironment, and you breathe it out again. So this is a test that, again, can be done at home. There is no limitations on who can do it, as long as you can sort of easily suck in a dry powder from an inhaler, like many children do for asthma. Wait a few minutes and breathe out into a collector. This gives you a at-home, hopefully highly compliant test. And we started this test without using an inhaled form. We injected the probe into patients. We performed a stage 2 trial last year, and even at the earliest stage 1 cancers, we were already getting close to 68.5% sensitivity. So you can detect cancers this early using these sort of approaches, and we're aiming to, we're running a stage 1 this week on our inhaled probe, where we hope to make this test usable for everyone. Okay, and I'll just close up saying I've given a whistle-stop tour here, just described the different applications you can use for breath. You can see there's a thread through them. It's about getting these diagnostic tests into the home, maximizing compliance, finding diseases as early as possible, where they're easily treatable. And I think it fits with what other speakers have been talking about, prevention. These are all hitting the diseases when they're asymptomatic, early enough that you can make a difference, like maximizing health for as long as possible for everyone. Thank you very much.
Fantastic. Thank you so much, Dr. Allsworth.